Hi, welcome and good morning, everyone. We are live today with Dr. Helene Simons, and we are going to be doing something amazing today. Dr. Simons was awesome enough to jump on with us last minute to offer this training on telehealth. If you're watching this live or possibly in the replay right now, I want you to know that she's going to be giving an in-depth presentation on what it takes to start up your telehealth practice, nuts and bolts, beginning to end. We're so grateful for her today. So, Dr. Simons, for anybody that doesn't know you today, why don't you go ahead and introduce yourself?
Great. Thanks so much. I'm super excited to be here and share all this valuable information with everyone. I am Dr. Helene Simons. I have a doctorate in clinical psychology and a group practice located in Denver, Colorado, where we have a team of 3 doctoral level psychologists working in our practice, specializing in therapy with mood disorders, eating disorders, addiction and relationship issues, as well as telehealth services to a few different states now, Colorado, Michigan, and New Jersey and California, as well as psychological assessment. So I have been using telehealth in my practice and training my colleagues in it since 2017, and I am very excited to be here today and share that knowledge with all of you.
Love that. And I want you to know as we get started, today is an interactive presentation. We already have some comments coming in, but if things pop up that you'd like to ask questions about, please do leave them in the comments and we will pause and do our best to answer them for you. But before we get started today, I'd like to invite in Marina, who is the representative with Sandstone Care, and she's going to give us an update on Sandstone and what's going on with them. So Marina, thanks for joining us today.
Yeah, thanks, Danny, and thanks, Dr. Simons. So I'm Marina, like Danny said, and I'm on our clinical outreach team here at Sandstone Care. And for anyone on the training today who isn't already familiar with Sandstone Care, we are an adolescent and young adult treatment center providing age-specific care for ages 13 to 30, except for our medical detox level of care where we're serving people from 18 all the way up.
And as expected,
care.
Okay.
So I'm on our, like I said, our clinical outreach team, and we specialize in aftercare planning. So we're stepping down clients from our IOP down into the community. And so if you are in private practice, specialize in substance, and are accepting new clients, please get a hold of me. I'd love to connect with you. And as for updates, how it's going over at Sandstone during COVID. So we were able to transition our entire intensive outpatient program level of care over to telehealth within 48 hours. It was an incredible mobilization effort by our leadership team. It was really cool to see. So we are delivering IOP and OP through telehealth, but we're still seeing clients in person at the medical detox, residential, and PHP levels of care. So again, I want to invite Dr. Simons back on and just say we're so excited to have her. This training was born out of a response to the community, and I'll hand it back to you guys. Thanks so much.
Awesome. Thanks, Marina, for joining us today. So I'm going to take you off. And as you saw, there was a little tiny little glitch there. I do want to let you guys know that as we get rolling, that Facebook, YouTube, Zoom, everybody is seeing unprecedented levels of streaming right now that they're not able to keep up with. So if we do have technical difficulties today, I want to encourage you to stick around, work with us. We're doing a pretty big long stream today, and we just ask for your patience and grace as we deal with issues that are outside of our control. So let's get everything set up for Dr. Simons today. And let's see what we have for a comment. Callan Crow is present. Now, this is how it will work. So as you comment, we're able to show you on screen, and we will engage with your comments as we move forward. So if you have a question, ask it. I'm the moderator, so I will hop back in and make sure that we do talk about your questions. Now, Dr. Simons, I do want to quickly kind of set the stage. When it comes to like technology, you're not a technology expert. So when it comes to problems with Zoom, things like that, this isn't really your thing. And if there are questions, I'll do some research on the back end to get your answer. If so, that hops up.
Thank you. I really appreciate that. Yeah, I am have a lot of experience with telehealth and what you need to know as a clinician offering that to your clients and to the community. But that is correct. I am not an expert in software development, IT issues.
Okay. All right. So are you ready to start?
I am, yeah.
Great. We've got 41 live viewers right now. Thanks for hopping on. If you have clients, or if you have colleagues or groups that you're a member of that would like to see this that might not be on Sandstone Care's Facebook page, then we would love for you to click that share button, share this into groups, be a resource for your other clients, because we got this together fast, and we want to thank Dr. Simons for doing this. So I'm going to hop out, Dr. Simons, and let you take it away. You will hear her ask me to do next slides because I'm running tech today. So don't let that alarm you. She's just going to tell me when she needs to move on. So take it away, Dr. Simons.
Great. Thank you so much. Okay. Yeah. So today we are going to be talking about telehealth video therapy. It's going to be an in-depth look into how to use video conferencing in your work. It will be very comprehensive, but I'm sure that there will be other things that you will be curious about. So I really highly encourage you to kind of come in, comment, ask questions along the way. This is the first time I've given a live webinar. Usually I've given a lot of presentations in person and encourage a high level of discussion and communication. So hopefully we'll be able to figure out how to do that on this portal. All right, next slide. Let's get started. All right, so first of all, I want to thank Sandstone Cares for having me today and setting up this awesome live stream event. I'm really grateful to be here and to help the community. I'm just gonna kind of tell you a little bit about my work and my practice to kind of set the stage. So I am Dr. Helene Simons. I have a PsyD in clinical psychology, and I am the founder of my group practice, Simons Therapy. We have 3 doctoral level psychologists with specialties in eating disorders, addiction, mood disorders, and relationships. We practice in person in Cherry Creek in Denver, Colorado, and we also offer telehealth video therapy services. We actually offer those to a few different states. So we are offering telehealth video sessions to people in Colorado, Michigan, New Jersey, and California. So we are super excited about that. And then we're also offering psychological assessment in our practice. So that is still in person. And that includes everything from intellectual functioning, ADHD and learning disability evaluations, mood disorders, neuro testing, all kinds of different opportunities there. And then in addition to that, we give a lot of professional consultations and trainings and continuing education events. So if you are interested in having one of us speak at your event, we would be happy to arrange that. We also give community seminars and roundtables to people who are not practicing as clinicians, but just to the community at large. So please go to our website to learn more about our work and what we're doing. And then as far as the telehealth goes, we have been using telehealth since 2017. I personally use it on a very regular basis to increase access to care in all of the communities that I mentioned before. So it's been a few years now, and I've really had a great experience with that and kind of learned a few things along the way. So I am excited to share that with you today. All right, next slide. Okay. So just a bit of an overview on telehealth. Telehealth is being used more frequently across all types of healthcare. We are seeing this coming up in many, many different fields, and it's gaining recognition as a very important tool to help people in the community at large really access care. And so I think it's really important to know this as we talk about how it's used in mental health and how it's going to start being used in mental health care, to kind of have a whole wraparound picture of where it's been so far and where it's going. So in this presentation, we're going to learn about video conferencing and how it's being used already to meet the mental health needs of the community and how it will continue to meet those needs. We're going to explore the risks and rewards of using this type of care. And then we're also going to be highlighting specific changes and things that are going on right now in response to COVID-19. Next slide. Okay, so our learning objectives today are to gain an understanding of how telehealth is being used across health fields, specifically how it's being used in psychotherapy to help mental health professionals, to talk about the pros and the cons and the risks and rewards of using this type of service. And also, we're going to be highlighting best practices and guidelines of how to really use this in a way that is the most effective and helpful as possible. And again, look at COVID-19 and how the community and different licensing boards are really reacting to COVID-19 and using telehealth to help make that happen. Next slide. Okay, so technology. So technology is really, really important. We've seen it impact society in a lot of really incredible ways. We are in what I would call a technology-driven society, where our devices and our types of technology really help us in a lot of meaningful ways. Already to date, you can, think about the own use of technology in your home and in your practice. Most people have smartphones, we use tablets, we FaceTime or video chat with people that are important to us, like friends, family, and loved ones. People have been working remotely for years now and really using technology to meet those needs of different employers and different opportunities. There are also online courses for all levels of education, even high school education, as well as higher education is being done online, conference calls, and video conferencing. So we have been using technology really to help us in a lot of different fields and in life for years now. And so it's important to realize that and know that a lot of people are kind of already in this place. Next slide, please. Okay, did we just skip one, Danny? It looked like two of them flashed by. Okay, great, thank you so much. Okay, so instant gratification is something really important to talk about as well when it comes to technology. Technology allows us to meet this need, right? So I don't know if you've noticed this in your families, your friends, your clients, but there's a high need for instant gratification right now, wanting things to happen immediately, wanting things to be produced, achieved, or provided right at the time that it happens. So text messaging is a great way to kind of demonstrate this, right? People expect an answer immediately. We want to consume information right at the time that we wanted it. And our tech devices have really allowed us to make this happen as far as the news, as far as what's going on in the world and the people around us. Technology has allowed us to not only fill the need for instant gratification, but also make that need an even larger one. If you think about your smartphones and your devices, you can talk to people instantly, you can get anything that you're researching instantly right at your fingertips. And so, there are some impacts that has on the world in general, and some impacts that it has on our clients in our field too, right? Is that there's more of an expectation of wanting those needs to be met right away and wanting them on your time. And I think that it's important to recognize this as we talk about technology and how we're using these devices to help meet these needs, kind of having a bigger picture of what society is looking at in those regards. Okay, and I just want to take a minute. I've noticed that some people have been coming in after we got started. So I just want to remind everyone that I am giving this presentation and really enjoying doing it over webinar. I do love a high level of questions and commentary around the way. So please jump in, ask your questions, offer any insights that you've noticed as I'm highlighting some of these things that you've seen in your own practice, and work along the way too. So that would be great. Okay, Danny, next slide, please. Thank you. Okay, so the idea of consumer-driven healthcare delivery. So this is a concept that's really important to think about as we think about how we're using technology to meet the needs of the community at large. So when you think about this term, it's important to think of patients or clients, whatever terminology you use to describe the individuals that you work with, as partners. Okay, so we want to think of the community at large as a partner in our pathway towards driving and delivering healthcare and mental health care services. This is sort of a new concept that's come across in the past few years or so. Up until recently, it has not been that way. So historically, our healthcare system has been driven by the healthcare providers and the insurance companies, right? It's a top-down approach where the people who have the training, healthcare providers, the people who have the resources, insurance companies or other big name players, are the ones who are really driving the way that health information has been given to the community, as well as how it's accessed. And that has been the way for a very long time. When we started getting more and more advanced in technology, that started to change. And a big reason of that is that more information is available to the public, right? So if you think about what you can access on Google, or what people in general can access on Google or any search engine at all, really information is available to them all the time. It's available to us. So for example, you can go on WebMD, you can go on Google, you can look up the Mayo Clinic, you can research symptoms and signs of pretty much anything and get some kind of an answer. Now, those answers are not always accurate or consistent. And, just a disclaimer, I'm certainly still in favor of going to a physician when you have an issue and getting that checked out by a trained professional. But this is my way of really kind of exemplifying the fact that we're in a different world than we were in, let's say 50 years ago, let's say 20 years ago, right? Technology has really gotten us to a place where where the consumer can access information. And so it makes sense then that as consumers are accessing more healthcare information, they are really asking for us to meet their needs in a different way. Okay, so the healthcare systems have had to try to change and meet the needs of the community and where they're at. And it really, this technology and internet interface has created a major disruption in the way that we have served the community and offered healthcare before, as well as changed the way that we look at consumers and expect and access care. So that's really how it's gotten to this point of us kind of joining with the consumers and meeting their needs in the best way possible, which in my opinion, I'll just give you my opinion, I think is a really good thing, right? Because we want to serve the community in the best way as we possibly can. All right, next slide, please. Okay. Okay, so this is more information on consumer-driven healthcare technology. So as consumers, because of this, because of instant gratification and more information about healthcare in general, having more access to information at our fingertips, we as consumers not only want to get healthcare information instantly, rapidly, conveniently, and accurately, we also expect it. More and more we are in the tech age that we're in, the more we expect it to be both accurate and instant. And so, like I said, that we were using search engines to self-diagnose ourselves. People are speaking to healthcare providers and getting diagnosis and treatment as fast as they possibly can, when they want it and how they want it. And so that's really pulling on healthcare providers as well as mental health care providers to respond to this and help meet the needs of the community. So this has impacted healthcare across the board, not just physical healthcare, but all different types of health, including mental health. And it's changed it to the point that the consumer really drives the healthcare systems. And that is an important thing to recognize because it helps us understand how we're at a place of telehealth video work, right? We have to have an understanding that over time, as technology has rapidly changed and brought increased access to care, it's also communicated to our consumers that we can give more and more information in more easily accessible ways. And I really do believe that telehealth, video conferencing, is a way to provide and meet that need of the community. Okay, next slide. Okay, right, so use of technology in healthcare. Also, when we're talking about our work as mental health professionals, it's really important not just to look at what we're doing in the mental health field, but also what is being done and what has been happening in other areas of healthcare for a while now, or for the past 10 years, 5-10 years or so, depending on the different healthcare domain. So that kind of helps set the scene. All right, next slide, please. Okay. Sorry, was this the next slide or was it the other one? Perfect, thank you. Okay, so telehealth. Telehealth has been a way for a lot of different areas of healthcare, a lot of healthcare professionals, organizations, to really bridge the gap between the consumer and the provider, and to really increase access to care for people across the board. So one way that telehealth kind of started being used and started getting its momentum going has been to target populations that have limited access to care in general. So when you think about certain populations, right, like rural populations, remote locations, different types of areas that are less well populated and have less medical care to begin with, those are some of the areas that first started getting access to telehealth services. And what that has done in a really great way is it's allowed different areas to have more access to services that they might not have, right? It allows us to bring specialized care to really meet those communities and to really bridge the gap in care overall. It's also increased prevention and care as well. So, you know, on another slide, I'll talk about different healthcare systems that are using telehealth. One great way that it's being done in the medical field is increasing prevention and care. So having an initial primary care consultation over a telehealth platform can help people understand what they are struggling with, kind of triage their symptoms, and know whether or not they need to go in person to see a medical professional, or if it's something that they can handle at home. So it's also allowing us to prevent higher uses of care as well. Another great thing that telehealth does is it decreases wait times. If we have more providers that are able to create care and provide services to people over the internet and over video conferencing, then they're not waiting as long to get that met. Maybe they're waiting in a virtual waiting room and they're able to do other things that they need at the same time while waiting for their appointment. They may also not have to wait as many days or months to see a specialist or to have an initial consultation or to get in with any kind of doctor that they're looking for. And so it really helps make care a lot more accessible, both in terms of timing and broad range of practice as well. Okay, and so I'm just going to pause here for a quick second because I'm noticing more people coming in to watch this stream. So I'm going to pause periodically to just remind people that this is a opportunity for you to comment and interject questions along the way.
Yeah, and it looks like, Emily, we have a really good question right now. Helene, Emily has a good question. Is Zoom HIPAA compliant?
Yeah, so we will talk more about software HIPAA compliance specific for mental health a little bit later on in the presentation. Yeah. Sorry, excuse me. So, like I mentioned earlier, I am not sorry, I have something stuck in my throat. I'm not an expert on technology and IT across the board. Okay, So I do have some knowledge and understanding of HIPAA compliance with particular software, but I can't, sorry.
Yeah, no, you can't really go into the depths of each individual platform and the inner workings of how it works. But a quick Google search, which I'll do in a minute, will probably show that HIPAA or Zoom is pretty HIPAA compliant, because I know a lot of platforms are using it right now, correct?
A lot of them are, and part of what I'll talk about later too is that a lot of things are changing rapidly right now. Over the past week, there have been changes across what level of HIPAA compliance you actually need to meet with people right now in the midst of the coronavirus. Different software and platforms have changed all different types of their functioning in order to become more HIPAA compliant or to respond to needs of the community. I can't speak to each of them individually because these changes are happening on such a rapid basis. It's my understanding that Zoom has different levels of licensing depending on if you have a free version or a paid version and what type of an organization you are. And so it's I think that the HIPAA compliance depends on what your account type is, but I am not positive.
Yeah, and we're not going to fall on either side of the fence, but do a quick web. From what everything I'm finding, it is HIPAA compliant, but yeah, do your research. So yeah. I'm going to hop out, but I love this. So we already have somebody kind of hopping in saying the free version of Zoom is not HIPAA compliant. Only the purchase version of Zoom is. So again, we're not laying our hat on this, but go do your own research to find this. So I'm going to hop off. And again, all this interaction is great. There is no dumb question. If you're thinking of it, it means somebody out there is thinking of it as well. Please bring it up. So I'll let you get back to your work, Dr. Simons.
Okay, thank you so much. So we can go on to the next slide, if you don't mind. Okay, right. So we sort of highlighted how telehealth is being used in different healthcare settings. So it's being used in primary care. It's being used for sick patient visits, dermatology, dietary support, lots of different ways. And right now, in response to COVID-19, many primary care physicians are doing initial telehealth consultations to triage symptoms of coronavirus before sending you in to see someone in person or to get a coronavirus test. So it's really, these changes are happening on a day-to-day basis. We're also seeing this used now, I mean, even just over the past few days, actually, a lot has changed in the mental health field, which I will talk about as well. But many treatment programs, kind of like Marina from Sandstone told us at the beginning, many treatment programs are offering higher level of care, intensive outpatient programming, and some partial hospitalization programming, depending on the provider, also to meet the needs of the community over telehealth care right now too. Okay, next slide, please. Okay, so mental health. We as mental health care providers can also use telehealth services to meet the needs of the community. And so that is something that has been recognized in our field for years now. It is something that is being used already before the coronavirus came into play for psychotherapy, psychiatry, mental health care across the board. And it really, that's something to know that right now today we have a huge demand for it because of the situation that we're in globally. But this is not a new concept. As I mentioned earlier on, my group practice, Simons Therapy, has been using telehealth in our practice to meet the needs of the community since 2017. There are lots of providers who have been using telehealth to meet mental health care for a long period of time. And so this is not something new. What's new now is really the need for a lot of us to do this imminently. And so I'll talk about how that has kind of changed a bit too. Okay, next slide, please. Okay, so what is telepsychology? So telehealth is a large term umbrella for healthcare services that are delivered over a video platform or really using kind of any internet service, technology service to meet the needs of that community. So telehealth is a wraparound concept that's not just about video conferencing, but also different kind of patient portals or online portals and communication systems, electronic health records, etc. Telepsychology, according to the APA, is a provision of psychological services using telecommunication technology. So similarly, it's not just the video conferencing, it's all the ways that we interact with our patients or clients by using technology. So that's important to know, because it's important to not just know what software do I need, how do I give a video appointment. It's also important to know how to do that within a larger context of what kinds of things we need to be thinking about when we work with clients over technology in general and when we work with them in a remote way. So in order to help us do that, the American Psychological Association has set forth a number of guidelines on best practices that we are going to dig into one by one in a really in-depth way to understand what we need to know and what we need to do as mental health care providers to really meet the needs of the community. Okay, so the APA has set forth some of these practices and guidelines. Guidelines are what they like to call informed by professional theories, evidence-based practices, and definitions in order to inform the psychological community and uphold the highest standards of ethics and professionalism in practice. So a key word here is guideline, okay? So these are not necessarily rules or laws. They're guidelines. They're ways of us, sorry that these little bubbles that pop up are a little distracting. They're ways of us kind of keeping ourselves in track and knowing which way to navigate. And that's important to keep in mind, because we will talk about a lot of different guidelines and rules, and we will come across the need to also check with different licensing boards and jurisdictions for actual laws that are in place. We can't just go by the guidelines of the APA. Okay, and I will, again, encourage questions and comments along the way. So thank you. All right, next slide. Okay, so benefits of telepsychology. So very similarly to other types of healthcare, having telepsychology is very beneficial for increasing higher access to care overall. So it's a great way to meet the needs of rural communities. It's a great way to meet needs of communities with fewer providers or without specialized care, and it's also convenient. So as far as rural communities or communities with fewer providers, there are a lot of pockets of, I'll just use the United States in general. There are a lot of pockets of the United States that have huge amounts of care and services available, very dense services, or a lot of services in one place. And there are a lot of areas of the United States that have smaller populations, that have less providers in the mental health field, and then also less specialized providers in those areas too. So telehealth can be a really great way to meet the needs of those communities. For example, one of my specialties is working with eating disorders. In Denver, we are very lucky to have a lot of wonderful professionals who are very specialized in treating eating disorders. Denver's sort of a hub in Colorado and neighboring states for eating disorder treatment. But there are pockets of Colorado that are not, or don't have that much availability to them. And so one way that I've been using telehealth in my practice for the last few years is to provide specialized treatment to areas of the state that don't have specialized training and don't have as many providers who are specialized in treating eating disorders.
Hi, Dr. Helene. I wanted to we have a comment from Kelly Trotman. I want to throw it up on screen for you real quick. She says, from Wild Transformations Therapy here, I'm almost entirely telehealth now and having more luck with doxy.me, both through my private practice and contract work with addiction recovery centers in Boulder for individual and group therapy. My clients are struggling on the user end to access video sessions using Simple Practice due to installing it on their device. Not sure if you have any advice on workarounds where they could just click a link from an email.
Okay, yeah. So I guess we will come back to this slide. So I'm not very familiar with Doxy.me. I've heard of it. Simple Practice is wonderful. I use Simple Practice in my practice. It's an electronic health record that is fully HIPAA compliant. And yes, if you have your patients or clients set up to receive email reminders of their appointments, in the email that they get, there is a link to the appointment itself that they can click on at that time. I have noticed that Simple Practice, the software has been a little bit slower in terms of its stability. It's a little choppy and has sort of a tendency to freeze, I've noticed recently. I've had better experiences with Zoom. I have the HIPAA compliant version of that. So, yeah.
Awesome. Thanks for that.
Yeah, absolutely. Okay, so back to the benefits of telepsychology, right? So, yeah, so it really gives us the ability to bridge care and bring treatment, specialized treatment to areas that may not have that. Another great benefit of telepsychology is that it's incredibly convenient. I have a number of clients that I work with myself who live in Denver, but sometimes it's really hard to get in, to see you in person. They're busy, they're working all day, they have families, they have a lot going on in their lives, and finding, an hour to 2 hours to come and see you because of the time it takes to travel to your office may be a lot to ask for some people. So a lot of people enjoy the convenience of being able to just take their computer into a private room during lunch or go home and get it all streamed and ready to go at the end of the day or at the beginning of the day before they go to work. So, video services are really a great way to meet the needs of people overall. Specifically for coronavirus, we are obviously in a time that is very different than what we're used to. So interestingly enough, Sandstone Cares asked me to create this presentation and give it today, but they asked me not this past Monday, but the Monday before. And so it's been, 10 days, almost 2 weeks since that initial conversation, and things have changed drastically in that time. So, we are now in a period in many states, Colorado being one of them, where we are needing to stay at home, and we're really trying to only provide essential services in person. Now, mental health care is considered an essential service, but I would argue that it's also important to not put our clients in a position that is going to jeopardize their health, safety, and well-being. So we are really lucky as mental health care providers that we are able to provide services to our clients without jeopardizing their physical health. There are a lot of people that we work with on a regular basis. There are a lot of people that we share office suites with and buildings with who are coming and going. And my opinion is, if we can, why not kind of not expose ourselves to that? Why not protect our clients from coming into contact with the virus? Why not see them over a video platform? So that's obviously the major benefit right now, and a huge reason why most of you are here today to learn about this. So yeah, let's go on to the next slide. Okay. Now, for those of you who have been using telepsychology already in your practice, whether it be this week or for a few years now, you will have noticed that there are some drawbacks to this type of work. There are some risks too that we'll talk about, but first we'll hit on the drawbacks. So one is technology. Technology is wonderful. It's great. It's allowing us to do more than we've ever been able to. It's absolutely fabulous. And At the same time, it doesn't work all the time. Okay, so your software may freeze. There may be a lag in the conversation. I don't know how to call that. Danny is an expert on technology and could tell us like what exactly that is, but basically sometimes things don't get delivered at the same pace that you want them to.
I would love to talk about that.
Thank you.
Great timing. So what we have when it comes to when we're doing these types of presentations, there's two different factors. There's download speeds, meaning how fast can we download a movie? How fast can we download content to our device? And then there's upload speeds. Most people don't pay attention to the upload speed at all, but that's how quickly can we upload information to the internet, to the Zoom platform, to the streaming platforms. What I recommend as a streaming expert, anything lower than 5 megabytes per second from an upload perspective, you're going to see problems like mismatch audio, delays, things like that are going to create issues. So look for an upload speed, and that's simple as going to speedtest.net to check that. It'll give you your download speed and your upload speed. I'll put that in the comments for you to run that for at home. So hope that answers that question.
Great, thank you. Okay, so those are some issues that we see. Specifically in the mental health world, there's this idea of the screen as a barrier. And so it's, when you think about giving mental health care, when you think about doing therapy, we all think about the space that we're in terms of how we deliver services and how we meet with people. Most of us, for example, have thought a lot and put a lot of time and energy into figuring out how our offices are set up, what kind of furniture we have, what the furniture and the space looks like and feels like to really create a warm and comfortable environment for our clients. And so some of the drawbacks on telehealth is that the screen can be a barrier to that. It's literally a physical divide that is up between you and your client. You're not in the same physical space. And you also haven't created that space and comforting area for them. One of the benefits for doing therapy in person is the ability for someone to leave the stressful world that they are in and come into a place that represents comfort and safety. And when you're providing mental health services over a video screen, the people that you're providing it to may not be able to do that. They may have to meet with you in a space that is stressful, in a space that they are talking about. So that's one thing to think about that. In my work with telehealth in my practice for the past few years, one way that I have tried to help my clients overcome this is talking to them about how they set up the physical space that they're in when we meet. If they work from home, it would be important that they don't meet with me or with you, depending on, what's going on, that they don't meet with their provider, their home office, that they're meeting with them in a place that to them represents some level of comfort and safety and privacy, of course, as well. So, that's one thing to think about and talk to them about. Another one is, how do they, especially right now for your clients who you do normally see in person and are now having to transition into this telehealth world that they might not be so comfortable with, some things to talk to them about are how do you recreate the therapy environment? What are some of the things that they have appreciated about coming to your office or your space that they can recreate for themselves at home? For example, in my office, we have a hot water heater with tea and hot chocolate that's available to our clients. That's something that you can talk to your clients about. If there's someone who always likes to have a cup of tea, the blanket that might be on your couch, those types of things, maybe they can set that up for themselves. So that's one way to overcome that drawback. Another drawback that some people report is building rapport. It can be harder to build rapport when there's a screen between you and your clients. They don't see the full picture of you. Again, they're not in a physical space that may offer a sense of comfort and compassion and safety. And sometimes it can be harder to build that rapport. Another thing that can get in the way of that is kind of that I already forgot the terminology that Danny gave us, but that lag in the technology, right? So sometimes the technology might freeze, or we may not come across at the pace that we think we are. And that can be hard to build rapport too. Some people have reported to me that they have found themselves cutting their clients off a little bit more over video conferencing than they do in person because of that lag time. And so really all of those things can get in the way of how you build a relationship with your client over a video screen. Now, one best practice that a lot of us do, and actually some states mandate people to do, it depends on the state, is that you meet with clients 1 or 2 times in person before going to a video portal. One of the reasons for that is rapport. In Colorado, that is not a law. You can start a relationship with a client in a telehealth setting. You don't have to meet with them in person first. There are states that have required that. A lot of those states in response to coronavirus are no longer requiring that because it is, just not something that we can do right now because of coronavirus. But anyway, rapport can be harder to build when you're over a video service. Another distraction to telepsychology, another drawback to telepsychology is distraction. So that can happen to you as a provider, and it can happen to your clients. I don't know about you, but when I have clients come into my office, my phone goes right on to do not disturb. It is 50 minutes of time where the client and myself, neither of us are on our phones. We are present in the space that we are in and in the conversation that we are having. Now, when you start to do therapy over a screen, you have a lot of opportunity for distraction. You have anything and everything that's available to you on your computer and on the internet that you could access at any time while you're providing therapy. And same thing for your clients. And so it really takes a high level of self-control to really hold yourself to some high expectations and shut down everything that's going on in the background or could be going on in the background during that time so that you're really fully present to your clients. And also recommending that they do the same, because it's kind of second nature to get on a computer and start, checking emails or Google or whatnot. And then we talked about the benefit of the therapeutic environment and how to simulate that at home as well. And again, I welcome any comments or questions about what anybody else is doing to overcome any of the drawbacks or risks that we're talking about through this presentation. Okay, next slide. Okay, so there are risks to using telehealth video therapy. I think in some regard that's somewhat obvious because there have been so many rules and regulations about how we can use it. That really speaks to how those risks evolve. So I will highlight some of those. And again, if anybody has come across any risks or safety concerns that they have noticed that I don't highlight on, it would be really great if you don't mind putting that comment up here. We really want to try to offer as much information as possible to everybody watching this presentation right now. So I welcome those comments. Okay, so safety concerns. So when you have someone in your office, you minimize some of those safety risks. When you are meeting over a video platform, it can be hard to make sure that their safety is intact. For example, if you had someone come into your office and they were communicating risk of suicidal ideation and they had a plan and intent to hurt themselves, you would do what you need to do and you would get them to the hospital, right? If they weren't able to carry out that plan with a loved one, you would be calling the police and making that happen. How do you handle that when the person is not in your office and they can literally turn off their screen at any time during your session? Okay, so that is a safety concern, is that the level of control that you have over managing risk of any kind of harm is not is available to you. One way of navigating this risk is telling your clients that one of the expectations of video therapy is that they have an emergency contact on file, that is somebody that you as the provider can call if there is a risk of self-harm, so that somebody in the community physically nearby can come and help handle that situation. Another way to navigate that is making sure that you have an up-to-date address on file for where the person is physically located at the time of every session you do with them. That way, if they are communicating, I'll use suicidal ideation as the example again, if they are communicating that, you know exactly where to tell the police to dispatch themselves in order to help that person. So that's one way to mitigate that risk. Another aspect of, there's a lot of different aspects of safety concerns or just risk in general. I have mentioned a number of times now that I work with people who are experiencing eating disorders. It can be challenging to do that work over a video platform because you can't see the full body of the person. So you may not get as accurate information as to if their weight, for example, is in healthy range, if they are taking your recommendations to go to physicians or other providers to make sure that their vitals and everything are in the place that they need to be. So figuring out ways to really have a robust treatment team can be another way to navigate safety concerns. Having other people who are also having physical eyes on the person can help. Now, again, with COVID-19, that's a little bit harder to do. Excuse me. So it really takes a level of creativity and involving sometimes family members as emergency contacts to help with safety concerns of particular individuals. Excuse me. Okay. So, and then information security. Technology has, again, I'm not an expert on every technology platform and IT in general. However, technology is great. There are a lot of different services and programs that have really amped up their security and privacy settings to make the platforms and software that we use as secure as possible. That being said, whenever you're using any kind of technology or technology platform, you run the risk of somebody hacking into the system or some kind of a security break occurring that that leaks that information. And so one risk to using telehealth is confidentiality and whether or not the privacy is upheld for your clients. So we'll talk about this a little bit more when we go into the guidelines of best practices from the APA, but one way to kind of deal with that is really to own that upfront. It's really important that when you're talking to your clients, you're explaining to them some of the inherent risks of doing this work over technology and making sure that they understand the risks of that as well. Okay, so we can move on to the next slide. Again, if anybody has noticed any other risks that they want to share, please let us know. Okay, so the guidelines. So we kind of went over this a little bit before, but these are the best standards of practice that are demonstrated by the APA. One really important thing to note here is that technology evolves rapidly and frequently. And I mean, really, I can't highlight that enough. We are seeing that right now with the coronavirus. We have seen drastic changes on a day-to-day basis in regards to this for the past couple of weeks. There have been major changes from when I first started preparing from this presentation a week ago to today, even from yesterday to today. So it's really important that you always use these guidelines as a guideline, but still look up laws within your different jurisdictions or communities as well. Okay, so these are ways for us to evaluate the best way to handle these types of situations. Next slide, please. Okay, so there are 8 specific guidelines. Next slide, please. And you can find these on the APA website as well if you wanna look them up and reference them. So the first guideline is the competence of the psychologist, and I will read the quote and then go into some explanation. So take reasonable steps to ensure competence with both, this is important, the technology that you are using and the potential impact of the if the technology impacts clients, parents, supervisees, or other professionals. So not just you need to be competent in 2 things here. One is your work and how you deliver care in general. Okay, so competent within your fields, within your areas of specialty, within the populations that you are working with, and the technology that you're using. Now, the APA is not saying that we all need to become experts in technology or IT gurus or anything like that. I certainly am not. It is saying that you need to have a reasonable level of understanding of the platforms that you're using with your clients. So you need to know, for example, if a client experiences you freezing on the screen, how do they handle that? Is the software that you're using with them HIPAA compliant or not? You need to be able to answer that question. Is the space confidential? What are the risks of their privacy being interrupted? You need to have an understanding of that and communicate it to the clients. And then—
Hi, Dr. Helene.
Hi.
I wanted to just quickly interrupt as people are doing what you're asking questions as they pop up in their mind. We had a question about e-signatures that I thought you could breach quickly for Stasia. What is the best practice for obtaining e-signatures?
So again, I'm not an expert in different types of technology. I can speak to the practices that I use. So, and some of the ones that I know about, I don't know about all opportunities. I use Simple Practice for my electronic health record. I like it a lot because it allows e-signatures to take place. It's very streamlined. It sends confidential documents to your clients and gets their signatures and brings it back to you. There are a number of different electronic health records out there that do that. I don't know the names of all of them, but you could look that up. Other options that you have for e-signatures, DocuSign is another software that does that. That is not free. I'm not aware of any free services that allow for e-signatures. Some people do send forms as attachments in an email and then ask that their clients print them, scan them, and send them back to them. I mean, I'm not an attorney and I can't, so I can't really speak to whether or not that's totally kosher, but I would say that if you do that, you're running the risk of what I've talked about, which is privacy and security being hacked, and you're sending in, basically you're having clients send in confidential information over an email, which if it's not encrypted, that's an issue. So this is a very long way of me saying it would be in your best interest to look into a actual e-signature situation.
And we have Jacinta saying,
I have never heard of DigiSigner.
Great.
Yeah.
Thanks for helping. And thank you, Stasia, from the
encrypted emails.
18th District Attorney Office Diversion Program. Thanks for hopping on and asking your question. I'll let you continue, Dr. Simons.
Hello. Okay, great. Yeah, and thank you for asking questions and providing comments. Like I have been saying, the more we do that, the better. So speak up. Okay, where was I? Right, also encouraging us to provide and document clinical rationale for using technology. So, these are guidelines that were created prior to the coronavirus. These are guidelines that the APA has had in place a long time now on how we use telehealth video services. But basically what they're saying is if you're not able to see this person in person, document why. Technology is than if you were not to use technology. Okay, and so you want to also stay educated on the different aspects of technology that are affecting clinical care. As I said, you don't need to be an expert, but having some level of knowledge of that is important. Kind of like an example would be us right now just talking about e-signatures, encryption, and privacy would be an example of staying educated on that. Become informed, create, and implement emergency procedures. This is really, really important. So in a couple slides ago, when I talked about safety concerns as a risk to using telehealth video services, this is really important to this guideline. So you need to know, in the case of an emergency, how are you going to help your client? What is your procedure if something happens? And so different ways to handle this, like I said, are having an emergency contact on file, making sure that you have documented permission from the client that you will contact that emergency person if needed, letting them know what that procedure is going to be so that they realize what's going to happen in those situations as well, and knowing where you're going to send them to in the community that they're in, knowing how to safety plan over a telehealth platform will also be important. You want to have a list of community resources to provide the client with. Okay, so this is important. For those of us that, I think the majority of people who are watching this are in Colorado. I don't know. But so if you are practicing in Denver, Colorado, in person, you have probably built up a network of individuals in the community that you can refer to, right? So if you are a psychologist, you probably know where to send somebody for psychiatry. You probably have figured out other types of professionals, maybe dietitians, physicians, etc., treatment centers for higher levels of care. You have an understanding of the community and where you can refer someone to if they need a particular service. Now, if you're using telehealth to go into a community that you are not in, you still need to be able to do that. You still need to be able to know where you're going to refer your clients to if they need psychiatric medication, if they need to be hospitalized, if they need to go into detox, if they need to go into a PHP program for a particular issue. And so the APA is telling us that it doesn't matter if you live or work in that community, you need to make sure that you're on top of that and know where to help send them to. Excuse me. So for example, I've mentioned a few times that my practice provides telehealth services, not just in Colorado, but that we are also approved to be, or that we do. We provide services in Michigan, New Jersey, and California as well. And so we, have built up networks in those areas too, to know where to refer our clients to. Right, and then you need to be able to make an in-person referral for the client if they're too high of risk for telepsychology. So that is a really interesting one, right? Because what that's saying is that there may be some people that we are working with who should not be seen over a virtual platform. Maybe they are too high of risk for that situation. And so it would be good to know what your opportunities are for referral if you need to terminate that therapeutic relationship and refer them to someone that they can see in person. Now, I cannot speak to how this is being handled with the COVID situation. Well, actually I can. The way it's being handled with the COVID situation is that mental health care is considered an essential service. And so we are permitted to meet with our clients in person right now. Most of us are trying not to and are using a telehealth platform, but we still can. So if you are in this situation and you've transitioned one of your clients to a video platform, but you are able to meet with them in person, you could end the video relationship and go to just in person. If you're not comfortable with that from your own physical health, you may want to know who you can refer them to in the community who is comfortable still meeting in person. Any questions or comments on Guideline 1? I'll just throw that out there. And if anyone does, shout out. Okay, next slide. Okay. Standards of care in the delivery of telepsych services. So the APA wants us to ensure that ethical and professional standards and practices of care are met at the outset and throughout the duration of telepsychology services. Okay, so what does this mean? It means that you need to uphold all the same ethics expected of you that you already did. Okay, it's pretty self-explanatory. You need to practice in an ethical way, even though you're over a video platform. So what does this mean? It means working under your license. It means working within your scope of practice, consulting with other providers and colleagues that you have when you need to, staying up to date with training, education, continuing education events, keeping your licensure up to date, and upholding and complying with the laws, regulations, and standards of the jurisdiction that you are practicing in. So we are going to talk about that piece a lot. But basically what this is saying is you are under the rules that are governed by the licensing board that you are a part of. If you are licensed in the state of Colorado, you need to follow the laws, regulations, and standards of DORA, of the Department of Regulation Affairs in Colorado. So you need to make sure that you're complying with that, even if you're offering telehealth services. Okay, let's go on to the next slide. Okay, informed consent. We still need to obtain conformed consent just as we would in an in-person situation. You want to obtain and document informed consent that specifically addresses the unique concerns related to the telepsychology services you provided. So this is an important thing to know. Everybody should already be getting informed consent at the start of the therapeutic relationship in writing from your client, where you are in detail explaining who you are, what your level of training is, what your licensure is, how you practice, etc. Now, if you're going to move into a telepsychology situation, then you have to give the same informed consent that you normally would, outlining everything that's important to outline, and you need to get additional informed consent on the use of video conferencing, telepsychology, telehealth as well. So that's really important to know. The informed consent should outline the nature of the therapeutic relationship, specifically as it relates to a telehealth setting. So what those risks are, what the procedures are for emergency situations, some of the things that we've talked about before, really communicating that to the client and making sure that they're understanding of that. The APA is also encouraging us to consider and develop policies and procedures that address potential threats to data security. So you want to think about what you would do if that were to happen, and you need to put in your informed consent that that is a possibility that could happen. And then HIPAA compliance. Okay, so this is another one that will come up and has already come up throughout the presentation. The APA wants you to use HIPAA compliant software and uphold HIPAA all the time, because that is best practice and that's what you need to do in order to protect your clients and serve them in the best ways you possibly can. Now, in response to coronavirus, there have been changes with HIPAA. HIPAA is, for lack of a better word, becoming more lenient. Basically, during this emergency period, that we're experiencing with coronavirus, HIPAA has been made to be a little bit more lenient. We don't necessarily have to, and again, these things are changing on a day-to-day basis. So just because I say something today does not mean it will be the same a week from now. And it does not mean that that's where we were last week. So that is my disclaimer. But as of today, there is some leniency on HIPAA compliance in terms of the software that you use to work with your clients. My professional opinion is that best practice is to always use something that is HIPAA compliant. Just because we are allowed to FaceTime today in response to coronavirus does not mean that that is the best way to practice telepsychology in the field. So my recommendation would still be to use software and portals that are HIPAA compliant, but that is becoming more lenient, and you can look that up again on a day-to-day basis, because it is changing on a day-to-day basis, to see where that's at. Excuse me. Okay, any questions or comments on that? Okay, I will take that as a no. But if they are, please pop them up. Again, I really do encourage conversation and discussion. So yeah, okay, next slide.
I'm going to hop on because Emily posted a question real quick. And there is about an 18-second delay between what we're saying and what users are getting. So they could kind of pop up as they come. And sorry for interrupting you, but they might kind of come as we go. But where would we look it up? So those changes, those HIPAA changes, where would we look that up?
I don't have a specific website, but if you literally just Google HIPAA compliance coronavirus or COVID-19, it is, I'm pretty sure it's one of the first things that comes up on there. I don't know if the APA has a link on their website to that or not.
Okay. We have Jenny that says, can you recommend other platforms that are HIPAA compliant?
Yeah, so any electronic health record is going to be HIPAA compliant. It's my understanding that doxy.me is HIPAA compliant. I haven't used that one in well over a year. So my assumption is that it's the same, but verify that if you need to. Zoom, if you pay for it, we learned earlier in this presentation, is HIPAA compliant.
And I did some research on that, and there's a $200 plan, the Zoom healthcare plan, that if you're there, you're HIPAA compliant.
Okay, that's good to know too. Yeah, and then
what about FaceTime? Somebody said you mentioned FaceTime.
I did mention FaceTime. I mentioned that it's not HIPAA compliant.
That makes sense.
And that right now, in response to coronavirus, the regulations on HIPAA are becoming more lenient. So as of the last time I looked at this with HIPAA compliance was Monday. As of Monday, you could use non-HIPAA compliant video software to meet with clients. FaceTime is an example of a software that's not HIPAA compliant that you could use. But my recommendation would not be to do that. My recommendation is still to use something that is HIPAA compliant because that is a best practice. And now we have a comment from someone who is saying that VC is also HIPAA compliant.
Yep.
That is one that I had heard of. My understanding is that had been free up until the end of last week, where they stopped offering it for free because so many people were using it that they couldn't offer it for free anymore. But again, things are changing on a daily basis with these softwares. So
totally. Yeah. And again, if you're watching this in the replay, meaning you're catching this after the fact, Dr. Simons, will you respond to comments in this thread?
Mm-hmm. Yes, absolutely.
Okay. So even if you're not able to catch this live with us, you have something else going on, and you're watching this in the replay, please do respond at any point to what she's asking, and we'll make sure she kind of follows up in the comments to answer those questions at a later point.
The best way to really get a hold of me with any questions that you have is to go to my website. There's a place my email is on there, and there's a place to also fill out a form inquiry, and I'm happy to answer any questions that come up. I will say that that's the easiest way to get a hold of me, because emails that come straight to me, I tend to be way more on top of than multiple platforms.
Gotcha. And I know you're getting a lot of tech questions today too. So we have somebody saying, can you recommend an app for group therapy that is HIPAA compliant but cheaper than Zoom? So the $200 a month price point is a lot.
Yeah, I cannot. That is something that my colleagues and I, not just my associates at Simons Therapy, but colleagues that I have throughout the United States have been talking about. And I cannot identify one. It's my understanding that VC potentially has the ability for that. Again, it's not free, and I don't know what the limit is on the number of people that can come in. If you do pay for the Zoom healthcare, then you do have the ability to do group therapy through Zoom.
And thank you, Jacinta, for posting this Dora from Colorado.gov for updates for consumers. We appreciate you for sure. But as Dr. Simon said, right now the policies are very lenient. So FaceTime is acceptable for now. Google Hangout is acceptable for now. But moving forward, I think it's great advice from you, Dr. Simons, to be HIPAA compliant, to be in a position to learn in a state where you can move forward and not have to adjust. Correct?
Yeah, and I mean, and not just that, but my opinion, right? It's I want to uphold my clients' confidentiality and privacy to as much as I possibly can. That is a hallmark and tenet of mental health care, is that we are working with our clients in a confidential way. And so I understand that we are, in a crisis right now, but I personally don't think that means that we can throw HIPAA out the window. So. That was a very opinionated response, but
sure, that's okay.
I'm an opinionated person, so that's what you got when you're taking.
Kelly says, I emailed all my clients asking that they review and sign the telehealth disclosure ASAP through my EHR Simple Practice, and many have not returned it. I know there's more leniency now, but how would you respond in your documentation to this with liability it may entail? People not returning.
I personally wouldn't, because, as I said, I'm not offering non-HIPAA compliant services to my clients, so that can apply to me. As far as them not responding and filling it out, my opinion would be that you don't meet with them. You make it very clear that you're not going to deliver that service if that form isn't signed. And again, I'm giving a very opinionated response here, but we have responsibilities as mental health care professionals to protect our clients and to protect ourselves. If you're not protecting yourself in your malpractice situation, then you are jeopardizing your ability to help all of your clients, right? If you have an issue with one, then you are going to have an issue with helping everybody that you're trying to help. And so the policy in my practice is, if that document isn't signed, that telehealth session is not happening.
Love that. Okay. So Stephanie, Brian, you asked where are the DORA guidelines. Just look up. Jacinta posted those DORA guidelines. So we'll let you continue, Dr. Simons.
Thank you. Okay, so let's go on to the next slide. Okay, confidentiality of data and information, more on HIPAA. So the APA wants reasonable effort to protect and maintain the confidentiality of the data and information relating to their clients, patients, and inform them of their potentially increased risk of loss of confidentiality inherent in telepsychology. This right here is why it's important to get that consent form signed. I mean, this really, really exemplifies it for us. What this is saying is, yes, there are risks in telehealth. Yes, maintaining confidentiality is significantly harder to do when you are working over an internet or technology interface than it is when you are meeting with somebody in a private setting, one-on-one in person. And so it's our responsibility to not only communicate that to our clients, but also to make sure that they understand that and are consenting to that risk before we see them. Inform clients of the limits of confidentiality and document that consent. So that is a guideline of the APA. Be aware that electronic communication has security breach. Yeah. So again, in response to that comment of what do you do if your clients don't sign the form? Well, according to the APA, the answer is you don't see them. You have to get that informed consent. Okay, next slide. Security and transmission of data and information. So we are to take reasonable steps to ensure that security measures are in place to protect data and information related to clients or patients from unintended unintended access of disclosure. So again, reasonable steps. Okay, this language is important. It means it's the APA communicating to us that we don't have to go like way above and beyond here and make sure that we're experts in literally everything, but we should take the reasonable steps to really make sure that we are doing enough and know enough. So potential threats that we need to be aware of and try to mitigate are hackers, viruses, theft of your device, out-of-date technology, poor security, inadequate software. So again, you don't have to be an expert in IT and all things related to hacking and software, but you do kind of need to know, you do need to use technology that's relatively up to date and that meets the needs that you're providing and has the security available for it. So again, this is really confirms kind of what I'm saying about HIPAA, which is right now we're in a situation where we don't necessarily have to uphold HIPAA, but you really do want to, according to the APA, to really protect your clients as much as you can. And then it's recommended to encrypt electronic communication and information. So again, these things are important because right now what everybody's wanting and most concerned about is how to do the video conferencing. But once you move into the telehealth and telepsychology, you really need to be aware of a lot more than just the video conferencing. You need to think about how you're emailing confidential information, either to your client or to a colleague for consultation, or someone that you have an ROI with in the community who's also seeing the client, maybe for psychiatric medication or something like that. You really need to think about how you're delivering that information and communicating with them. I'm going to promote electronic health records again because I think that they offer a high level of ability to communicate with our clients in a secure fashion. So I would recommend an electronic health record, and certainly encrypted messaging. Along these lines, I've given this presentation in person before. A question that came up then was text messaging with clients. I don't think it's appropriate to text message with clients. It's not confidential. There's no security on it. It's certainly not encrypted. You have basically no control over what happens to that message. So that's just one example of, a real life application to that. Did we just get a question? Yeah. Would that be? I think this is in regards to the electronic health records. So Emily is asking, would that be something like Simple Practice? Are there others you recommend? Yes, Simple Practice is an electronic health record. It's the one I use. I would recommend it. Other ones that I recommend, Therapy Notes is one that I have heard people really enjoying and doing well with. I can't remember off the top of my head some of the names of the other electronic health records, but again, a quick Google search will bring about a bunch of them. Things that I would advise when you're choosing your electronic health record are the security and confidentiality, whether or not it offers that video conferencing for you in a secure fashion, and reviews from other people, how much they've enjoyed it and meeting their needs. And also I would say how long it's been around for. You don't want to go with a new company that has risk of not being there in a year after you've taken the time and effort to convert your entire practice to an electronic health record. So, yeah. Is there part of a law that would prevent a multiple private practice therapists from purchasing a single healthcare provider account for Zoom and sharing the use of it between them all? I do not know. I apologize, but I'm not comfortable answering that question because it's out of my scope of practice. I would ask an attorney.
We had a question on one of the shares. So we want to thank everybody that's been sharing these videos and getting it out there. And I think this question more is a support question from somebody dealing with EMDR clients. And she says, Marshall McCarthy says, I have a question. I have a number of clients that are not comfortable continuing to do trauma work in an online format. I do EMDR, and many of my EMDR clients have asked that we put our work on hold until we can meet in person. Thoughts? So I think just as this is more of a compassion question. How do you help somebody that has clients that aren't able or aren't getting there? Are there ways that you help people get over the hump of embracing it?
Yeah, that's a good question. And I'm not trained in EMDR, so I can't not speak to whether or not you can do EMDR over telehealth. I don't know how that works, in terms of the lights and the, all the technology that's involved in EMDR. That being said, there are certainly people who are having a hard time with this idea of going to telehealth and to video. It's not something that everyone's comfortable with. I've certainly had people, say that to me. And I think that there's a couple different things to do there. One is, it's always important to meet your clients and your patients where they're at. So communicating that you understand that this may not be ideal for them, really hearing them and empathizing with that is important. And then another piece, because we can't force people to do that.
Sure.
Another piece is I personally have noticed that changing a lot over the past 2 weeks. So I have been, I've been using telehealth in my practice since 2017. My practice is currently strictly telehealth due to the coronavirus, and has been since not this past Monday, but the Monday before. I don't remember what date that was, maybe March 13th. I don't know. So I have been in that situation since then. Now, when I first sent out an email the weekend before last and started contacting my clients and telling them that I was going to video, there was some pushback that people were just going to wait a couple weeks until I was back in person. Now that we are getting more and more into a situation that we don't know how it's going to end and we don't know how long it's going to go on for, there are more people who are becoming more open to this as it's better than nothing approach. Obviously, the coronavirus is having significant effects on the mental health of everybody. We all know that as mental health providers, and we all know that that impact is going to grow tremendously over the next undetermined period of time. And so my advice would be to check in with your clients, have some conversations over the phone, listen to what they're afraid of, try to address how you're going to be able to do that. Maybe give them the opportunity to do like a free short 20-minute consultation with you over video, walk them through what that platform is like, get them used to the situation. But at the end of the day, you can't force people. So
thanks for that advice.
Yeah.
All right, let you continue.
Thank you. Where were we? Okay, so I think, we're ready for the next slide. Okay, guideline 6, disposal of data and information and technologies. Make a reasonable effort, again, keywords here, reasonable effort, to dispose of data and information and technologies used in a manner that facilitates protection from unauthorized access and accounts for safe and appropriate disposal. So this is, if you think about ethics and what you know of what it means to practice ethically, you know that we are required to keep records, for example, for 7 years after the termination of treatment with the client, and then dispose of them in a secure way, i.e. a shredder, right, for the confidentiality. So basically what this is saying is now if you're going over to a technology platform, you still have to uphold the person's confidentiality all the way to the end, not even just the end, but to the point of moving on to another technology system. So that's just something to keep in mind when you're done working with people, that you're doing that in the best way possible. It's also important that you're thinking about that, for example, as you're interacting with clients, like through encrypted email, those kinds of things, of how you're disposing information that gets sent back and forth. Okay, next slide. I think, there we go. Testing and assessment. Okay, so this is referring to psychological testing and assessment. Consider the unique issues that may arise with test instruments and assessment approaches designed for in-person implementation when using telepsychology. Psychological assessments are intended to be conducted in person. So basically what this is saying is when it comes to psych testing or neuro testing or learning disability testing, ADHD testing, etc., those are standardized protocols and measures of assessment, and they're standardized with in-person situations, right? Like that's how they came to be the way that they are. It's really important, you know, when you're administering those tests, that you are doing it in the way that you're supposed to, as deemed by the test that you're using. So what this is saying is basically the gist here is you still have to do testing in person. My practice offers psychological assessment, everything from neuro testing, intellectual testing, learning disability, ADHD, extra time, memory issues, disability, etc. The way we are handling this in the midst of COVID-19 is basically that testing is sort of on hold right now. We're still doing clinical interviews. So we're doing initial consultations to understand the referral question. We are still providing people with the clinical interview to understand the issue more and gain that background information. And then we're having conversations with them of when they're going to be able to be tested. As I've mentioned throughout this webinar or live stream event is in response to the coronavirus, we as mental health professionals are considered essential services. And so you could, perform psychological testing in person during this time, depending on how long this goes on for and how essential a timeline is for people is what I would recommend for that. So for example, in my practice, through the end of next week, we're not meeting in person. We're going to evaluate on a week-to-week basis. People who need disability evaluations for a particular time period will likely be handled differently than people who have more time and can wait until some of this has gone down. So it's really taking it an individualized approach. Next slide, please. Okay, interjurisdictional practice. This is usually what everybody wants to know, or at least that seems to be the case when I've given these presentations live before. So Guideline 8, be familiar and comply with all relevant laws and regulations when providing telepsychology services, to clients and patients across jurisdictional and international borders. Okay. Laws may vary by state. Most states, so I'm not going to read this one-on-one, but basically this is answering the question. So my client used to see me in person because they're a college student, and because the university is closed, they've been sent back to blank state. Can I still work with them over a video telehealth platform? The answer is it has absolutely nothing to do with the state of Colorado. It has to do with the state that your client went back to. So the answer to that is every state is different. How you're allowed to practice psychology varies from state to state, and you have to be licensed or uphold licensure requirements for the state that the person is in. So what you need to do is find out what that state will allow. Another question that comes up very frequently in this presentation is I just started seeing a new client and they travel frequently for work. They travel, domestically or they travel internationally. Can I see them as they travel? The answer is it depends. It depends on where they're going and what the laws are in the place that they're going to. The way this works in terms of licensing with telehealth is the laws apply to the place where the client, not the provider, but the client are physically located at the time that they are in the virtual therapy session with you. So for example, one state that I happen to know about is Nebraska, because I've looked into licensing in Nebraska. In Nebraska, you have to be licensed to see the person in Nebraska. There are no exceptions to that. There's no temporary exceptions to that. Now, I don't know if anything has changed with coronavirus, but as of like a month ago, that's how it was, or a few months ago. So it depends on the state that they're in. Now, another common question is, I'm thinking about taking my practice to be completely telehealth. I enjoy traveling, and I'm planning to see clients as I travel to different places. If I go to Hawaii, for example, can I still meet with my clients who are in Colorado over telehealth? The answer to that is yes. If you are licensed in the state of Colorado and your clients are physically in Colorado, it does not matter where you physically are in the world, you can still provide services to them. Now, I imagine that there are more questions on this. Does anybody have questions?
I have a question. What about vice versa? What if you're in Colorado and your client's in Hawaii?
You have to be licensed in Hawaii.
Okay.
Now, again, this is a state-by-state issue. In response to coronavirus, some states are, making changes or offering some temporary licensure situations. I know Dora has made some exceptions to clinicians who are not licensed in the state of Colorado, for example. So my recommendation is always to check with the licensing board of the state that you're talking about. But the jurisdiction, the laws that you're governed by apply to this, basically you need to follow the laws of the state that your client is physically in when they are going to be having their session.
Got you. Even if they're on a vacation for 2 weeks in Florida or somewhere, you need to be cleared to work with them for those 2 weeks.
Yes.
Okay.
But you can, as a provider, can travel the world and see people in the state. Well, at least in Colorado, you're allowed to do that. Again, this varies from state to state, and changes are happening literally daily in response to coronavirus. So, I'll
let you know if anything else comes up.
Yeah, thank you. What else does it say here? Oh, many providers will continue to uphold client care by seeing them when they travel, as long as they're typically seen and mostly seen in the state the psychologist is licensed in. Now, this is not something that the APA is saying. It's on this slide. It's just a comment from me, because a lot of people do that as a way to bridge care, but there's actually no clear guidance on that. There is inherent risk of legal trouble when you do that, and it's for a lot of states it's not allowed. So you really have to look at a state-by-state basis. So I'm just addressing something that a lot of people are doing. I'm not recommending that bullet point. We have another comment, I think. I can't click on it and see it. There we go. Emily says, hopefully they are more flexible right now. It's just temporary for the coronavirus issue. My University of Colorado students mostly went home. I agree with you that hopefully they are more flexible right now, but the harsh reality is that many states are not more flexible right now. Some states are. Some states are declaring that their response to have declared a state of emergency, and some of the licensing boards have responded to that by trying to become more lenient and offer some of this flexibility, but many states have not. Many states have not. New York, for example, has not made any changes on that. Alaska has not made any changes on that. I do not know every state off the top of my head, nor have I researched every state, but those are two that I happen to know about. Yeah. But what else was I going to say on that? Oh, there also in regards to this, there's been a I don't know, a movement that's a good way to put it, a movement to try to go for interjurisdictional practice long before coronavirus happened. This has been going on for years. That's been something that the community, the psychological community, has tried to make happen. There's been a little bit of leeway with that. They've created a couple of states have joined together to be able to offer some sort of reciprocity or like a pass that if you're licensed in one of the states that's under the pass, then you can practice in other ones. I do not remember what that pass is called. It's literally called something pass. You can look for that online. And that was its temporary thing to apply for through ASPBB. As of, it was either mid 2018 or mid 2019, I don't recall, but as of one of those points, they had too many applications and stopped taking applications for that. So that's not something that's currently available. Okay, let's go on to the next slide. So we were just talking about that. Yeah, crossing state lines, interjurisdictional practice. Some professions are creating a set of laws and credentialing process to help provide workers in various jurisdictions and cross state lines. So for example, this is really just my way of saying that the mental health field is way behind on this. There are a lot of other healthcare professionals that are using telehealth services, like I mentioned at the beginning of the presentation, who have found a way to make this happen. Physicians are one of them. Psychiatry is one of them. Nursing is one of them. There is a task force to create this in mental health. They've made some leeway by creating this pass that I was referring to. But as far as that goes, the application process was closed because they had too many applicants. To that, there is no like large governing force over all states in order to allow us to cross state lines. It is still a state-by-state practice. Okay, it looks like we have another question or comment. It's hard for me to see them. There we go. Will you please keep doing these seminars online? It is such helpful information and always changing. Thank you so much, Fail Addiction Recovery Services. I really appreciate that. I'm glad it's been helpful for you. Oh, and she added, and any other telehealth information resources would be helpful too. Thank you so much. Yeah, I give a lot of continuing education events and seminars in general to providers in the community. I also give, yes, you can go to my website to get help. Absolutely. So if you go to my website, www.simonstherapy.com, you can see that I give a lot of events for continuing education, professional training, also events to the community, where thank you so much for showing my website. I appreciate that. Yeah, so if you click on, I can walk you through this. So if you click on About, thank you. And that's about the practice. And then, sorry, it's a little hard for me to see, so you're gonna get a full screen of my face right now. If you go to, thank you. So if you go to events, you can see a list of events that we have given in the community. There's the one we're doing right now at the top of the page. They are a combination of continuing education events as well as events to help communities in particular. The ones that have a cross through them means they've happened in the past. Now, if you scroll back up to the top of the page and you click on consultation, down, yep, there, thank you. And you scroll down, you can see, that you can reach out to us to learn more to implement telehealth services, get consultation on that, get consultation on growing a practice or improving your clinical care. And you can reach out to us about that. And then again, if we go to the top of the screen and you click on training, yep. So this is just a page that highlights professional training and CE events. You can see us giving a live stream promotion of this event right there. And it just talks about kind of ways to reach out to us in order to arrange an event for your organization. Yeah, so you can submit an inquiry and you can sign up for our mailing list as well. And my email is somewhere on the site. You can also reach out to me directly. Yeah, and you can click on a link to book an appointment too. So yeah, I am happy to help. So thank you, Val Addiction Recovery Services. Please reach out and I would be happy to see what you would like to arrange. Okay, I think we were in the midst of a slide. We want to go back to that. Okay, next slide. Best practices for telehealth in general. So best practices. Get an address and phone number where the person is in case you need to send a welfare check to them. Get an emergency contact number with informed consent. Explain the process to them. Now, this slide was made a week ago. A lot has changed since then. Some mental health professionals require the first session or the first 1 to 2 sessions to be held in person. Some states actually mandate that a certain number of sessions occur in person at the beginning before the relationship occurs. Some states mandate that there's a certain number of sessions overall, like over your entire therapeutic relationship, that are occurring in person. So you do want to check regulations and look into that. Colorado is not upholding either of those. A lot of states are becoming more lenient on that in terms of coronavirus. But again, if you are looking into practicing in another state, you're going to want to make sure you get accurate and up-to-date information on that. I cannot stress enough that this is changing on a daily basis. Like I said, this slide was updated a week ago and things have changed in the past week. They have changed since yesterday. So please make sure that you are double checking as you are preparing to do this work, as well as you are doing this work. Once you get yourself set up for it, you really want to stay up to date with the laws and regulations because they are going to be changing throughout the coronavirus situation. Okay, next slide, please. Okay, in response to coronavirus. So the APA guidelines should still be upheld. Oh, we have a question. Can we get copies of your slides? Unfortunately not, no. I appreciate your interest and I'm glad that this information has been helpful for you. This webinar will be posted after it's over on the Sandstone Cares website. There will also be a link to my site to see it and to continue a conversation with me about questions you have. But these slides are not going to be distributed at this time. Okay, so coronavirus. The APA guidelines should still be upheld during the coronavirus. So again, things are changing on a daily basis. But if you're going to do this type of work, you really want to uphold best practices. Another question. Okay. What are the ethical considerations of seeing or not seeing someone face-to-face before starting telehealth services? As far as I know, there really are not any ethical issues at play there. In my own professional work, I have not come across any ethical issues with that either. It's just something that a lot of, I don't know how to really explain this. Okay, this is going to be an opinionated answer. So caveat there. Basically, as I've mentioned numerous times throughout this presentation, the mental health field has been a little bit slower to adopt telehealth services for a variety of reasons than other fields in healthcare. One thing that we really value as a mental health field is the relationship and confidentiality. So those are two things, right? And so some licensing boards and states feel that the best way to uphold that is to meet face-to-face first or to meet face-to-face at different times throughout. My opinion is that that's not necessary. A lot of states agree with my opinion and don't deem that as being necessary. As long as you are communicating confidentiality and upholding it throughout and really trying to create a safe environment for your clients and upholding all ethical practices than you normally would, there really shouldn't be any issues in terms of telehealth. Another pushback on that one, or another reason for that, is that over the course of telehealth becoming more widespread in mental health, there have been some professionals and practices who are not really in support of that, or feel that it is subpar in some ways to an in-person session. So they want some in-person situations as well. But I personally and professionally do not feel that that is the case. The clients that I have worked with over the past few years over telehealth also have not felt that that is the case. I think that if you are really delivering your services in the best way possible and staying authentic to who you are and upholding confidentiality and ethics, then that should not come into question. Yeah, so that's what I would say about that. Okay, so access to care is of the utmost importance during the coronavirus, right? So, I mean, like I said, we are in an unprecedented time that is changing drastically and frequently and will continue to do so for who knows how long. As we see this happening, we will see a higher need for mental health care in the community. 100% we will, right? In times of stress and hardship, people need support. They will be struggling, and they will need us. And so my professional and personal opinion is, why not use technology to help meet the needs of the community? Why not use technology to help preserve both the physical and mental health of the people in our communities, in our states, in our country, and in the world? This is the time to do that. And if that means that we're meeting over a video platform so that we can practice social distancing and prevent the spread of coronavirus, then let's do that. Let's figure out a way how. And I imagine that most of you agree with that, or you would not be here today watching this seminar. We talked about HIPAA compliance with COVID-19. It's more lax, but I do encourage you to check in on that regularly. As I said, state licensure is still required. You need to check with the licensing boards of the states that your clients are physically in. You also want to check with your malpractice insurance carriers about their ability to cover you for telehealth and their ability to cover you in jurisdictions that your physical location is not in, if you are able to practice in those. I think that the mental health field, us as professionals, we don't often spend a lot of time talking about the business of mental health. We spend a lot of time talking about the clinical care. But I really think that talking about the business of it is important. My belief is that if you are not thinking about how you are covered legally from a malpractice situation, an ethical situation, and a security and privacy situation, then you are not only putting yourself at risk, you're putting your entire caseload at risk. And those people have the ability to not see you anymore if you're not making sure that you're protecting yourself. So I would highly recommend that you do. Insurance. I cannot speak to insurance on a detailed level because, as you know, every insurance carrier operates in a different way. Each company is different, and each plan within the company is different. So I can't answer specific questions about telehealth and what's reimbursed from an insurance standpoint. I can tell you that in many states up until recently, Medicaid was not, and Medicare actually, neither of them, not in all states, I don't know all states, but in many states were not reimbursing for telehealth services. They were only doing in person. It is my understanding that in many states, they are now allowing you to bill them for telehealth services. Again, I cannot speak to each and every state. I'm really not even comfortable saying what Colorado is accepting right now because I'm not an insurance or Medicaid expert. But I think that that's really great progress in the right direction, and I would recommend checking with them if your clients are using those carriers. I think we have another question. What about, I can't see the whole question. Okay. What about phone sessions for clients who do not have video capability? So when you say what about, do you mean insurance, or what specifically do you mean, or do you mean confidentiality? I'll attempt to.
And while we wait for that answer, can we just give Dr. Simons a big round of applause up to this point for really giving all this information away to make sure that you're all prepared. So hearts and thumbs. And again, another way you can help is, this is great that this got to you today, but you have to understand is it didn't get to other people who need it. So just by clicking the share button is going to help us get to more people that need these answers today.
Thank you. Yeah. And if you can actually go to the next slide and just show my contact information, that would be great too. Thank you so much. Yeah, I want to thank everybody for coming today. Please, we have time now for discussion and questions, and I'm happy to answer those. Please go to my website to contact me individually. I'm happy to offer more information or arrange another webinar stream for your organization. I didn't see that question. Oh, that was a thank you. Oh, you are so welcome. You are so welcome. Yeah, please feel free to reach out. And I also offer consultation services, so I can, work with you one-on-one on what you're experiencing at this time. I don't know if the person that had the question about phone sessions came back.
We haven't had an answer yet, so we'll kind of hang out.
Okay. I guess what I'll just try to answer about phone sessions is confidentiality is not. Oh,
no, same question.
Oh, same question. So you cannot really uphold confidentiality as much in the same way over the phone as you can with these HIPAA client web services. So that's just something to keep in mind. You can do phone sessions though, that is allowed. As far as insurance reimbursement, I don't know. I don't do phone sessions because I do video. It's my understanding from colleagues of mine that I've spoken to, that insurance is reluctant at best to reimburse for a phone session, and that they will reimburse way more for video. Though I do understand that that some populations who maybe don't have as much access to Wi-Fi, are in remote areas, don't know how to work a computer or technology as well, may have issues with that.
Stephanie says, thank you.
You're welcome.
Her question. So we do have maybe a possible question. You can read this. I don't need to read it to you.
Sure. I've been updating my telehealth disclosure statement as you've been sharing suggestions and sending it out to clients using HIPAA compliant methods. Thank you. You are so welcome. My pleasure. I am happy to help. Yeah. And if people have questions that come up after this, I imagine that you will, as you're navigating this, please go to simonstherapy.com to reach out and learn more. We are very happy to do that. Thank you. I appreciate that. Getting some really lovely responses from you all. And
this is what community is about right now. We're not able to do this in person. We're not able to meet together. This is the best we have for the moment. And this has just been a fantastic use of everyone's time and your information. We can't thank you enough.
Oh, you're so welcome. I really appreciate that. And we are navigating this together as a community. So let's come together and figure out how to do that. There's certainly some hesitations and anxiety for mental health care professionals that are going into this for the first time. I understand that. I've been there, and I am more than happy to help walk you through that. I can, say for myself, once you jump in and get used to it, it gets easier. Personally, this webinar is a good example of that. It's the first webinar I've done, so I was certainly a little nervous at the beginning, but once you dive in, you get better. So I think, just basically think about how you treat anxiety and apply it to what's going on right now.
Yeah, and I will say too, from a tech side of things, if anybody doesn't understand tech, that's where I kind of come into play to make sure that things go well and you look well and you don't have to worry. You just get to do what you love.
Thank you. And thank you so much, Danny, for setting this up for us. and figuring it all out. I really, really appreciate that.
Yeah, and I want to let everybody know before we head out that at 2:00 today, there is a COVID-19 treatment panel happening with a lot of Colorado Treatment Center professionals. Work Reaver is at Spear Recovery. Marcello LaRocca is at Sandstone Care. Dr. Michael Barnes, Foundry Treatment in Steamboat, Colorado, and Drew Powers out of Maryland with Sandstone Care. So if they're going to be giving resources, things that they're thinking about from a treatment center perspective during this crisis. As we know, most things are brand new. There's not policies created. We don't know how to handle this. So we're going to talk as a professional panel about what it means to be in this era and make these policies and do what's best to keep our staff and our clients safe.
That's awesome. That's going to be great. Thank you for offering so many great opportunities for us during this chaotic time.
Well, we want to thank you.
I have a question for you, actually.
Yeah.
How do we share it with other colleagues?
I got that. So when this video is done, you can click the share button on the Sandstone Care page, and you can share this to other clients through Facebook. Now, we do want to use Facebook as a platform to spread right now because a lot of Americans, a lot of professionals are at home on Facebook. After the fact, this will be uploaded to Sandstone Care's website. I can't give you a timeline on how quickly their team gets that done, but I will send the file to their team and they will put it on their website. And when we're done with this, I can actually give you the file and you can put it up on YouTube and then send it out. So if anybody subscribes to your email list, which we showed off earlier, you can send it out in a YouTube link like you did with that last live video we did.
Yes, absolutely. So please go to my website, simonstherapy.com. And shoot me and get added to my email list so that I can send that out. Also, once this is over, Danny is going to be sending me a copy of the presentation, and I will be posting it on my website as well to share with the community. So please reach out and look into that.
All right, Veil Addiction, can you send the link for that? So it is happening in just 2 hours. It's on the Sandstone Care page. If you scroll down a little, you'll see the treatment panel live, and you can click Get Reminder, and you'll be notified as soon as we go live.
Yeah, and if you go to my website now and get added to my listserv, you can as well, or and also send me an inquiry, and I can send that directly.
I do believe there are no CEUs for this, Callan. I'm so sorry, but we don't have CEUs for this event today. This was a quick informational session we set up.
In response to that, I know we talked about that with you and I and Marina talked about that last week. As I continued to research this and become more up to date, I have come across a lot of different licensing boards who are changing their continuing education requirements and allowing more video webinars for that in response to coronavirus. So we should check into that.
Possibly. We'll look into that.
Possible that has changed. I don't know. Don't quote me.
Awesome. All right. Well, thanks again for your time today, Dr. Simons. We really appreciate you being an open slate and teaching today. You're an invaluable resource to our community. And for everybody, we appreciate your time and being a part of our Sandstone community. We want to be a resource for you moving forward. So find our page, like our page, make sure you're up to date with the things we have going on, because we plan to add much more information to help you grow and sustain in these really tough times.
Yes, absolutely.
All right.
Thank you for coming. Best of luck, everyone. Stay healthy.
Thank you. Bye-bye, everybody.
Bye.